Okay, thank you for offering to try this. I'm not testing you. I'm testing whether this tool makes sense and feels helpful. Please think out loud as you go through it. So you can go ahead and start by reading each statement and then choose the response that feels most accurate for you right now.
Okay. Prioritization. I feel confident prioritizing care for multiple patients in a busy clinical setting. So right now I would think that that's emerging. I can recognize when I need to ask for help and escalate concerns appropriately. I would say that I would do that mostly.
And what are you thinking as you choose?
I'm thinking about the clinicals that I've had, and specifically with help seeking and an escalation, I feel like I did a pretty good job of asking for help, especially when I didn't know something, especially in my preceptorship, whereas maybe before I would have, not noticed or not asked.
Okay.
I feel prepared to respond to unexpected changes in patient condition. Ooh. I would say emerging for that one. I can apply clinical judgment when patient information is incomplete or unclear. Oh. I would put emerging with that, but kind of in between these two, I guess, but more emerging than not yet, because I think that I have gotten some experience with that, but my nurses have been really good in terms of making sure that I understand certain orders or notice when maybe an order is not complete or when something needs to be clarified.
Okay, was any of the wording unclear?
No, I don't think that any of the wording in this was unclear. I thought that it was pretty easy to get through.
Okay, and did you feel uncomfortable by anything?
They're not about uncomfortable. I think each one of these questions makes me feel like when I first started nursing school versus where I am now, the change that has occurred. And so thinking back, it's kind of, it's a little scary thinking about how brand new, I guess, I was to it at the very beginning.
Okay, so that brings us to our next point. So based on what you've selected, the system would generate something like this. So you can go ahead and click on the view readiness pattern. Does this visualization help you understand your readiness?
Yeah, I think it does.
Okay, what is your first reaction to seeing this?
I guess it's good that I'm kind of hovering in the middle. Because I know that I'm not perfect, so I wouldn't expect it to be, full bars across. It's a little unexpected. I think that the prioritization is a little bit lower, but I'm glad that my help seeking is over that 50%, because I think that that's really important for brand new nurses.
Okay. What feels missing in this?
I think all four of those are major parts of really being able to be a bedside nurse. So I don't think that there's anything that is missing.
Okay. What would you expect the system to show next?
I guess I would want it to show me maybe different ways in which I can get better at these areas, maybe some practicing tools that I can use when I am bedside, that can continue like the development of each of these different things.
Okay. And as you're getting closer to graduating, would this reduce or increase your anxiety?
I think honestly, this actually reduces some of my anxiety, being able to see where I am at, maybe things that I can focus on, and things that I do better in.
Okay, great. Thank you.